Thailand is in the Southeast Asia, and we have the border next to Myanmar, Laos, and Cambodia and Malaysia in the south. Our population is nearly 70 million people, and the proportion of female is slightly more than male. And then we are in the upper middle income. We are in the upper middle income country as defined by the World Bank. Our GDP per capita is around 7,189 US dollars, while the GNI per capita is around 7,000. And the literacy rate of the adult is nearly 94%. And the life expectancy at birth in 2019 is 77 years. The life expectancy of the female is slightly more than male at 80 years, while for male is around 73 years. In terms of health expenditure, the government spends its 15% of the total government expenditure on health, and our health expenditure is around 3.8% of our GDP, or around 276 US dollar per capita, of which the 76% of the current health expenditure is from the public health expenditure, and 23% from the private, and only 0.3% from the external resources. Our out-of-pocket payment is only 11% of the health expenditure. So this is the information based on the World Bank's World Development Indicators in 2018. Okay, so let's come to the health resources in Thailand. We have around 36,000 medical doctors. Nearly half of them, or around half of them, are under the Ministry of Public Health. 48% under the Office of Permanent Secretary. The large proportion of the medical doctor under the Office of the Permanent Secretary is because all public hospitals in the rural areas are under the Office of the Permanent Secretary. That's why the large proportion of human resources are under this office. While around 5% medical doctors under other departments under the Ministry of Public Health. For example, the Department of Health, Department of Disease Control, Department of Mental Health, Department of Thai and Traditional Medicine, for examples. Another 25% of the medical doctors are under the public sector outside the Ministry of Public Health. For example, the Ministry of Interior, Ministry of Defense. The Army have its own hospital. The Navy also have its own hospitals. So also the hospital under the Ministry of Education or the medical schools are outside the Ministry of Public Health. While 22% of the medical doctors are under the private sector. So you can see that the distribution of the medical doctor across the country is we still have the problem of the imbalanced distribution. You can see that in the northeastern part of Thailand, there's a less ratio of the medical doctor compared to the central part of the country or the provinces near Bangkok. In terms of nurse, we have 117,000 registered nurse, and 60% are under the Ministry of the Office of the Permanent Secretary. and another 5% under the other departments under the Ministry of Public Health, and 18% under the public sector outside the Ministry of Public Health. You can see that the maldistribution of the registered nurse across the country, the same problem as the medical doctor, that in the northeastern part of Thailand, this is a low ratio per population compared to other part of the country. In terms of dentists and pharmacists, we have around 7,600 dentists. The majority, huge majority, are under the Ministry of Public Health, and only 5% under the private sector. Anyway, for the dentist or even the medical doctor or nurse, they do all practice. I mean, if they working out under the Ministry of Public Health, and then after working out, they can do the private practice as well. And for the pharmacists, we have 15,000 pharmacists, and then the 60% under the Ministry of Public Health. And we also have another type of the health workforce that you may have heard about, the village health volunteers. We have around 1 million village health volunteers across the country. These people are responsible for the 10 to 20 households across the area. Their role is to promote and prevent some diseases, supporting the work of our workforce at the health center, and provide basic services or provide the health information to the people in the community. They have been trained for 43 hours as a training, and then they have the follow-up training by our public health officers. Even they are the volunteers, we provide some subsidy for them, 600 baht per month. This is to subsidize their gasoline that they have to drive the motorcycle around the village to visit the people in the village. Another incentive is that they can get, we sometimes organize study visits or for them to learn the experience from other sites. And we also have the national awards for the recognition of the village health volunteers. And you can see that during the COVID-19 pandemic, village health volunteers become the key factors in coping with the pandemic as well. They're the one who deliver medicine to the people at home, or even do some home visit. So in terms of the health workforce distribution and retention, for medical doctor and dentists, we have the compulsory public service to retain them in the public health facilities for at least 3 years. And in terms of the financial incentive, they can get the hardship allowance in case they work in the very underserved area, and the non-private practice allowance that they can get some extra money if they don't do the private practice. This is the objective of non-private practice allowance, is to ensure that they pay attention or focus their work at the public facilities. Apart from the financial incentive, we also have the non-financial benefit. For example, the housing inside the hospital, that the medical doctor or dentist or pharmacist or even nurse that who might not be the people in that local area, they might not have the house within that area, they can have the housing facility from the hospital. So they don't have to pay more money to buy a new house if they work in some rural area. We also have the social recognition of the medical doctors who contribute to the work to the public. And this is another way that we can provide a non-financial benefit to the health workforce. In terms of health outcomes, you can see that based on the SDG 3.8.1 on the essential service coverage, our status is that the service coverage is 82%. In terms of the SDG 3.8.2 on the catastrophic expenditure on health, or the proportion of people who spend more than 10% of their households total expenditure on healthcare is only 2.2%. This is due to the public insurance schemes that we have to ensure that people will not have the financial barrier in access to the health services. And for the birth attended by skilled health staff, nearly all births by the skilled health staff at 99.1%. And in terms of cause of death, 76, nearly 77% of the total deaths are from the NCD, and the only 14% from the communicable disease, including maternal, prenatal, and nutrition conditions. And for the maternal mortality ratio is only 37 per 100,000 live births. And the mortality rate of the neonatal is only 5.3 per 1,000 live births. The vaccination coverage or immunization coverage of the DPT is as high as 97% among children aged 12 to 23 months. So those are the health resources part in Thailand. Another thing that this might be the basic understanding of Thailand is that our administrative arrangement. In Thailand, we have 77 provinces, of which the 76th province and plus Bangkok. Bangkok have its own administrative, which they can elect their own governor, compared to other provinces that the governors are sent from the central. We have 878 districts and 7,000 sub-districts. So we have province, we have district, and then sub-district, and then village. To get you have a better picture of the administrative at provincial level. In one province, they have around 10 districts in the province, and there is one main district. We call that Mueang district. This is the capital district. This is more urbanized. The health facilities are more advanced compared to other districts. Usually at the Mueang district, we have provincial hospital or some provincial hospital upgraded to the regional hospital or general hospital. For other districts, mostly they are in rural area, and but anyway, they have at least one district hospital in every district in the country. So you may know that in Thailand, we have full coverage of district hospital in every district. And we have 100% coverage of the health center in every sub-district. So if we compare the level of the administrative at province level, the head of administrative is a provincial governor. At district level, we have district chief officer, and at sub-district level, we have chief executive of the sub-district administrative organization, which is the local government. And compared to the health administrative, at provincial level, we have provincial public health office who oversee the health policies within that province. And at district level, we have district hospital director and district public health office. They work together as district health coordinating committee. So they come together and they discuss and also invite other sector in the district to develop the policies or the implementation at district level. And in terms of the health facilities under the Ministry of Public Health, at provincial level, we usually have general hospital and regional hospital. And at district level, we have district hospital. And at sub-district level, we have health promoting hospital. Even it is called hospital, it's actually the health center. But that as some prefer the word hospital, that's why we said the word health promoting hospital at the sub-district level. So we have the multi-level service delivery system. You can see that at sub-district level, we have health center. At district level, we have district hospitals. At provincial level, especially in Mueang district, we have regional hospital. And then for the more advanced health facility, we call that specialized hospital. For example, children's hospital, cancer hospital, what else? Skin hospital. All this specialized hospital under the Department of Medical Services. While the regional hospital, provincial hospital, district hospital, and health centers are under the Office of Permanent Secretary. That's why the majority of medical doctors, dentists, nurses, and pharmacists are under the Office of Permanent Secretary. For the health facility outside the Ministry of Public Health, usually we have the health centers and other public hospital under the Ministry of Defense, Ministry of Interior, for example. While for the tertiary hospital, usually the medical school or university hospitals under the Ministry of Education. And for the private facilities, we have the pharmacy or private clinics and private hospitals. And its capacity of the wide range of the capacity from the primary care to the tertiary care hospitals. So so I give you the picture of the health promoting hospital or the health center. Usually at the health center, there are 3 to 6 health personnel, depends on their catchment area. Usually their catchment area would cover around 2,000 to 5,000 population only. In terms of the health personnel, this include nurses and public health officers. And if it is the big health promoting hospital, they might have dental nurse, physical therapist, or a dietitian medicine officer. Depends on how big they are or how big their catchment area is. The medical doctor usually rotates from the district hospital to provide some special services at health promoting hospital. For example, for the NCD patients, the role of health promoting hospital is include the health promotion, simple OP service outpatient service, disease surveillance, and home health care. But for the district hospital, its capacity are count by the number of beds. The district hospital the number of beds can be ranged from 30 to 120 beds. And the number of population also, there's a wide range, maybe from 30,000 to 80,000 population. And the health personnel at the district hospital, the medical doctors can be general practice or specialists, depends on the number of beds or the capacity of the hospital. They have dentists, pharmacists, public health officer, the lab technicians, physical therapists, traditional medicine officers, and also the supporting team, including the finance team at the hospital. So if we compare the capacity of the district hospital and the health center by the service delivery or the items that they provide, at the district hospital, they can provide the outpatient, the complex outpatient service, while at the health center is very simple one. And for the inpatient, is only at the district hospital, so no overnight patient at the health center. At the dental, for the dental service at district level, as they have dentists, so they can provide more complex services. And at the healthcare center, it's only the simple one. Labor service only provide at district hospital, as well as the rehabilitation. And family planning, the maternal and child health, prevention, promotion, disease control, surveillance, and traditional medicine or home visit can be provided by both district hospital and health center. And in terms of the referral systems, there might be the different path, depends on how big the province or the district is. Usually the district hospital and health center that work together as district health network. So they work as a network within the district. The health center can refer patients to the district hospital. And if the condition of the patient is beyond the capacity of district hospital, they can be referred to provincial hospital, or even maybe directly to the regional or teaching hospital. But our referral system is not only refer up to the more advanced services. It can be the refer down system that after the patient get the services or they get the treatment, the regional hospital can refer patient back to the provincial hospital or the district hospital for the continuous of care, then to ensure that patient can get the service or the treatment that they need, or even the home visit after the treatment at the regional or teaching hospital. Apart from the services at the health facilities, we also have the community participation that the district health facilities, they usually work with all the stakeholders within their district. For example, the community, temple, school, local government, or even private sector. They conduct the public hearing for the problem analysis of its own community to get the priority setting of what are the key health problems of their community, and then try to figure out what can be the way to solve those problems. And then the local government and also the NHSO can provide the community fund to support those activities, mostly the health promotion activities, to ensure that all those activities are based on the context of the community, and the health problems can be solved by the community itself. Okay, so I think this is all the basic information of Thailand as the Thailand at a glance.